called for my presence, Your Majesty. How may I be of help to you?
What? Can you tell me what's really happening?
I have heard your sufferings all throughout the city of APEIROS, and I have a hunch that you have SLE, my queen.
What is SLE?
SLE, or Systemic Lupus Erythematosus, is a chronic inflammatory disease affecting the skin, joints, and kidney, although the disease may affect virtually every organ of the body. The disease was named after the characteristic erythematous butterfly rash over the cheeks and nose. Although the cause is unknown, genetics, hormonal, specifically disturbances in estrogen metabolism, and immune factors have been identified. Let me think. Drugs, including procainamide, isoniazid, are known to induce lupus-like syndromes. SLE affects women, primarily in their childbearing years. Menses and pregnancy can exacerbate the disease. Although the risk for systemic lupus erythematosus significantly drops during menopause. SLE, let me think, my queen.
Go on.
SLE,
But does it have a cure?
I'm very dreadful to say this, my queen. Although the course of SLE can be controlled, there is no cure. Mortality is usually a result of major lesions in affecting the major organ or a secondary infection.
Oh, I feel so horrible for acquiring such illness. You may now leave, little one.
I feel terrible for being the bearer of this ill news. I will now leave you to rest, Your Majesty.
The Queen is called for council. The Magi and our priestesses have arrived.
We have acquired information concerning your illness. Speaks thy knowledge, wise man. Please not say to this point. I will be her boss. The Queen is doomed to die. This can't be. What malady has struck our ruler? She is affected by the disease of her age.
To understand this disease, we must first understand the role of the immune system in its development. The immune system is the body's specific defense system. It identifies, stalks, destroys the pathogens that are foreign to the body. Its response to the threat is called immune response, which greatly increases the inflammatory response. It gives the body protection against specific antigens. If ever the immune system fails, the result would be devastating. There would be the development of devastating diseases such as systemic lupus erythematosus. The most crucial cells of the immune system are the T lymphocytes, B lymphocytes, and macrophages. The macrophages engulf the antigens and presents the debris of these antigens to the lymphocytes. The B and T lymphocytes arise from the hemocytoblasts, which are developed in the red bone marrow. T lymphocytes mature in the thymus gland, while in the bone marrow, the B lymphocytes mature. The B lymphocytes facilitate the antibody immune system, while the T lymphocytes facilitate the cell-mediated immune response. So pathophysiology. Due to the queen's predisposing factors of her age, sex, and early pregnancy, and the precipitating factor of her use of contraceptive pills, there is an increase in estrogen levels. The increase in estrogen levels greatly heightens the effects of the T and B lymphocytes while weakening the T suppressors. There would be increased T lymphocytes in circulation, and there would be hyperactivity of the B lymphocytes. The B lymphocytes will then produce autoantibodies, or ANAs.
ANAs, anti-nuclear antibody, is a screening test for diagnosing systemic lupus erythematosus and other collagen diseases. ANAs are immunoglobulins that react with the nuclear part of the leukocytes. It forms antibodies against deoxyribonucleic acid and RNA and others. 2-ANA, anti-DNA, and anti-D nucleoprotein are almost always present with systemic lupus erythematosus.
These autoantibodies lead to the cell death, and the cell death releases more antigens. And if there are more antigens, there will be the release of more antibodies, which will lead to the development of immune complexes. These immune complexes will then be deposited in different tissues of the body. And this deposition would elicit the multisystemic effects of systemic lupus erythematosus. Firstly, I would deal with the renal system. The renal system excretes the waste products and facilitates the return of needed materials into the blood. This filtration occurs in the glomerulus. Also, the kidneys have regulating functions such as the kidney secretes renin to regulate blood pressure, and erythropoietin to facilitate the production of erythrocytes. The erythropoietin is produced in the suprarenal cortex, down to the pathophysiology. Due to the deposition of the immune complexes in the renal tissues, there will be injury. Then there will be the release of bradykinins, prostaglandins, interleukins, histamines, and the complement activation. Bradykinins facilitate inflammation, and with the aid of prostaglandin, elicit pain. When there is inflammation, there will be increased blood flow and increased cellular capillary permeability. When there is increased capillary permeability, albumin will be excreted.
Albumin is a component of protein, and it makes more than half of plasma protein. It increases osmotic pressure, which is necessary for maintaining the vascular fluid. An increase in the albumin, like the queen has, will cause the fluid to shift from the vessels into the tissues.
And because of the complement system activation, there will be the mobilization of chemotactic factors in neutrophils. The neutrophils will then try to engulf the immune complexes embedded in the tissues. But due to their size, the neutrophils are unable to do so. And when they are unable to do so, there will be leakage of lysosomal enzymes. The enzymes would then destroy the surrounding tissues, resulting in tissue damage. The tissue damage would then lead to bleeding and hematuria. The tissue damage also occurs in the suprarenal cortex. There will be a disturbance in their hormone production. If the production of erythropoietin is decreased, there will be a decrease in stimulation of the bone marrow. And if the bone marrow is not stimulated, there will be a decrease in the erythrocyte production, resulting to anemia.
Due to the kidney damage, erythropoiesis is altered. Thus, RBC production is affected. That's why there is a decrease in RBC. Decrease in RBC would result to decrease in hematocrit. Hematocrit is the concentration of RBC in the total blood volume. The queen's hematocrit is 0.17 from that of a normal 47. This means that there is a decrease in the oxygen carrying capacity of the blood to the organ of needs. And this wise man confirmed that the Queen has anemia.
When there is damage to the glomerulus, there will be the loss and scarring of the filtration membrane, leading to the loss or the excretion of albumin. If there is a loss of albumin, there will be decreased colon and gothic pressure. And also, there will be excretory impairment. Fluids will be retained, which will lead to the increase in hydrostatic pressure. The increase in hydrostatic pressure and the decrease in the colon and gothic pressure would lead to fluid shifting and edema.
During the assessment of the Queen, there was an observed abdominal distension. Abdominal girth measurement was then performed with the initial measurement of 30.5 inches. During the final assessment, there was an increase in abdominal girth of 2.5 inches, resulting to an abdominal girth for the final assessment of 32.5 inches. There was also observed a bilateral inner thigh edema, pitting edema of grade 1. There was also pitting edema on her bipedal area of grade 3. Nursing management would include the monitoring of intake and output, and to encourage the Queen to comply with the limited fluid intake of 1 liter per day.
Further, the damage to the glomerulus would lead to decreased excretion of BUN and increased secretion of creatinine.
BUN, or blood urea nitrogen, is the main product of protein metabolism of the body. It is a chemical form in which unrequired nitrogen is being excreted out by the body in the urine. Urea is formed in the liver from ammonia and carbon dioxide in a series of enzyme-mediated reactions. Accumulation of urea is due to the damage to the Queen's kidney. The Queen's creatinine level has decreased from 0.6 to 1.3 of the normal value to 0.4 milligrams per dl. Creatinine is a substance derived from creatine and creatine phosphate. Creatine is a product of protein metabolism, and creatine phosphate acts as a store of high-energy phosphate in the muscles, which serves to maintain an adequate amount of ATP, which stores an energy required by the cell for muscle contraction.